Emergency Nursing October 2022. NCLEX. Emergency Nursing 105 Practice Questions and Rationales to Easily Crush the NCLEX. Chase Hessen. Chapter 1 NCLEX, RN Emergency Nursing Questions, Answers and Rationales. The following are 105 questions that will help you study for the NCLEX evaluation. All of the questions are based on things you might need to know in the area of emergency nursing. Compare your answers with the correct answers to see where you may need to study further. Good luck. 1. A 68-year-old male presents with left-sided weakness and numbness of 1 hour duration. What is the first thing you would do? A. Start N4 for TPA infusion. B. Draw blood for a chemistry profile. C. BC and clotting factors. C. Notify neurology about a possible stroke admission. D. Get a complete history from the patient regarding past medical history. Answer A. A stroke is a medical emergency for which TPA tissue plasminogen activator infusion is the proper treatment if given within 4 to 6 hours of onset of symptoms. If time permits, a CT scan can be ordered to verify that the patient has had an ischemic and not a hemorrhagic stroke. The sooner the TPA is given, the better is the recovery from the stroke symptoms. 2. Select the possible triggers for an asthma attack. Please select all that apply. A. Warm air. B. Cold air. C. Animal dander. D. Pollen. E. Inhaled corticosteroids. Answer, S, B, C, D are correct. Pollen, exercise, cold air, and animal dander can all trigger asthma attacks. Inhaled corticosteroids are a preventative measure against asthma attacks, and warm air does not usually trigger asthma attacks. 3. A patient with nonspecific chest pains is placed on a cardiac monitor. An alarm indicates the patient in asystole and you are the first person to arrive into the patient's room. What? A. Start cardiac compressions. B. Deliver 5 quick breaths. C. Determine that the patient is unconscious. D. Call a code blue. Answer C. There are many reasons why the alarm could have gone off, including disconnection of the machine from the patient. You need to first determine that the patient is unconscious before calling a code blue and beginning BLS and ACLS maneuvers. 4. A motor vehicle accident patient arrives at the ED and is in need of airway management. He is wearing a cervical collar, C collar. What is the appropriate way to establish an airway? A. Remove the C collar and perform a head tilt maneuver. B. Keep the C collar on and perform a jaw thrust maneuver. C. Immediately intubate the patient. D. Get out the ambu bag and apply to the patient's face. The first thing you should do? Answer B. Given that the patient was in a motor vehicle accident and has not yet been cleared as to the status of his cervical spine, the first thing you would do is perform the jaw thrust maneuver with the C collar on to see if this opens the airway. Removing the C collar might only do further damage to a compromised cervical spine. Intubating or using the ambu bag are things you would do once you determined that the patient does not have spontaneous respirations after opening the airway using the jaw thrust maneuver. 5. A patient has the automatic external defibrillator AED applied and the defibrillator is indicating a non-shockable rhythm. What is the next step? A. Override the AED and shock the patient. B. Check the leads on the AED. C. Resume CPR and recheck rhythm in 2 minutes. D. Turn off the AED and restart it. Answer C. If the AED is indicating a non-shockable rhythm, resume manual CPR and recheck the rhythm in 2 minutes. Turning off the AED and restarting it would only delay CPR and it is not possible to override the AED. The leads would automatically be on the patient for the AED to give the diagnosis of a non-shockable rhythm. 6. A 26-year-old female presents with abnormal vaginal bleeding, severe left-sided pelvic pain, and hypotension. Which of the following tests and interventions would you do? Select all that apply. A. Start N4. B. Obtain a urinalysis. C. Check a serum pregnancy test. D. Order a stat ultrasound of the pelvis. E. Order a CT scan of the pelvis. Answers A, C, D are correct. This a medical emergency and the patient likely has a ruptured ectopic pregnancy. A CT scan of the chest might take too long and a bedside ultrasound could clinch the diagnosis much faster. A urinalysis would not be helpful in this situation. 7. Which of the following is part of the guidelines for CPR by a health professional? A. Give 2 breaths for every compressions. B. Each breath should be given over 1 second, watching for the chest to rise with each breath. C. Deliver 2 quick chest compressions and then check the airway. D. Deliver 1 breath for 5 every 5 compressions. Answer B. You should have each breath given over 1 second, watching for the chest to rise with each breath at a ratio of 2 breaths for every 30 compressions. You do not give 2 quick chest compressions before assessing the airway. 8. For a child the age of 8 who requires CPR, the nurse should give 1 breath for every A. 10-12, B. 15-16, C. 6-8. Answer C. For a child, the proper ratio of breaths to compressions is 1 to every 6-8 compressions. Chest compressions. 9. An unconscious patient has a fine irregular pattern on the cardiac monitor. Which should be the next step? A. Put a nitroglycerin tablet under the patient's tongue. B. Start CPR. C. Take the patient's blood pressure. D. Check the leads on the cardiac monitor. Answer C. The patient has a rhythm suggestive of ventricular fibrillation. As he is unconscious, it is unlikely that the monitor is showing artifact. Taking the patient's blood pressure and using nitroglycerin under the tongue would only waste valuable time. 10. A child has a 2 cm dirty laceration on his forehead. What is the first nursing technique to use? A. Papoose the child and clean out the wound with saline-soaked gauze. B. Call the doctor to suture the laceration. C. Get out the staple gun to apply staples. D. Apply EMLA before cleansing the wound with saline-soaked gauze. Answer D. The application of EMLA will numb the wound so that cleaning with saline-soaked gauze will be less painful. The papoose may be unnecessary if the child has minimal pain with cleansing. Forehead lacerations are rarely sutured with staples and the doctor cannot suture a wound until the nurse has cleansed the wound of dirt. 11. A 17-year-old patient presents to the ED with signs and symptoms of bacterial meningitis. What things are appropriate nursing? 7 highlighters interventions. Check all that apply. A. Initiate anti-seizure precautions. B. Start and 4 at 300 cc per hour. C. Monitor for increased intracranial pressure. 8 highlighter SD. Monitor vital signs. E. Monitor neurological signs. Answer S, A, C, D, E are correct. The suspected bacterial meningitis patient may have seizures, so you need to start anti-seizure precautions, monitor for ICP, and monitor for vital and neurological signs. Starting and 4 at such a high rate only increases the chance for increased intracranial pressure. 12. When testing the motor responsiveness in an unconscious patient, one should do the following maneuver. A. Press on the upper orbital ridge. B. Do a sternal rub. C. Put pressure on the nail bed. D. Squeeze the gastrocnemius muscle. Answer C. To check for motor responsiveness in an unconscious patient, you must apply direct pressure with your nail to the nail bed of the unconscious patient. The other maneuvers are tests of the cerebral response to pain rather than a peripheral response. Motor response. Answers B, C, D are correct. The bed should be set to the lowest position and 4 should be started in case 4 medications are required if T. Patient has a second seizure. The bed should be padded as part of seizure precautions. The use of a tongue blade during a seizure carries many. CC 1313. A patient has come to the ED following a seizure. Which of the following nursing interventions should be undertaken? Check all that apply. Complications, including airway obstruction and tooth breakage. 14. A. Set the bed to the highest position. B. Have airway equipment standing by. 8 highlighters. C. Start and 4. D. Pad the sides of the gurney. E. Place a tongue blade at the table at the head of the bed. A patient presents taught the ED with signs and symptoms of Guillain-Barré syndrome. His past medical history likely consists of the following. A. Respiratory or G infection within the 4 weeks. B. History of head trauma within the last 6 weeks. C. Meningitis within the past year. D. History of a seizure disorder. Answer A. Guillain-Barré syndrome is a post-infectious disorder usually with a history of a respiratory or G infection within the past month. Trauma, meningitis and seizure disorders do not normally lead to a subsequent diagnosis of Guillain-Barré syndrome. 15. The ED physician orders irrigation of the ear in the ED. What should the nurse do? A. Have the affected ear face up following the irrigation with the patient on his or her side. B. Direct the stream to the wall of the ear canal. C. Use hot saline for the flush. D. Have the affected ear face up during the procedure with the patient lying on his or her side. Answer B. In ear irrigation, the patient should be sitting up with the ear tilted downward to allow for drainage of the ear. The solution used for irrigation should be at body temperature to avoid symptoms of nausea and vertigo. The stream should be directed to the wall of the ear canal, and not directly at the eardrum. The ED physician orders Manadol for the treatment of increased intracranial pressure in a trauma patient. What is true of Manadol for this purpose? A. Manadol is given intramuscularly. B. Manadol is an osmotic diuretic. C. Side effects of Manadol include tremors and increased intraocular pressure. D. Manadol does not cause electrolyte imbalances. Answer B. Manadol is an osmotic diuretic used to treat increased intracranial pressure. It is given by 4 infusion and has side effects of headache, nausea, vomiting, electrolyte imbalances, and disorientation. It decreases intraocular pressure. A. Answers. 17. A patient from an automobile accident is on a backboard with a C-collar and begins to vomit. What are the next appropriate steps? Check all that apply. A. Remove C-collar to allow patient to vomit with head turned. B. Suction the patient if necessary. 5 highlight ERSC. Turn the backboard and patient to the side while vomiting. D. Quickly undo the backboard only and get the patient on his or her side. E. Remove both the C-collar and backboard so the patient can sit up or turn to side to vomit. B, C are correct. The patient must have the C-collar on and the backboard until he or she is cleared for fractures of the spine. If the patient is vomiting, flip the entire patient and backboard to the side in order to vomit and suction the patient's mouth if needed. 18. An ED patient is suspected of having glaucoma. The nurse recognizes that the normal range for intraocular pressure using tonometry is A 25, B 610, C 1021, D 2540. Answer C. The normal range for intraocular pressure as examined by tonometry is 1021 mm Hg, 19. 4 patients arrived to the ED from the same automobile accident. In what order should patients be attended to? A 6-year-old patient with multiple facial lacerations. B. A 65-year-old patient with a broken hip. C. A 25-year-old patient with a blood pressure of 75/30. D. A 35-year-old with chest pain and bruising to the chest from the airbag. Answer C, D, B, A. The patient with hypotension needs immediate attention and the patient with chest pain may have a cardiac contusion from chest trauma. The 65-year-old patient needs an for in case of hypotension and the person with the facial lacerations needs suturing but this can wait. 20. A patient arrives at the ED with a lie burn to both eyes. No previous first aid has been given. What is the logical next step? A. Irrigate the eyes with normal saline until pH papers return with a normal pH. B. Call poison control for advice. C. Irrigate the eyes with dilute acetic acid. D. Irrigate the eyes with dilute HCl. Answer A. Regardless of the chemical in the eyes should be flushed with normal saline. 1. The irritant is acidic or basic. You can continue to irrigate the eyes until pH papers placed on the conjunctiva are normal. Do not attempt to use an acidic antidote. The call to the Poison Control Center would take away valuable time that could be used for irrigation. 21. A patient presents to the ED with a wood splinter penetrating the cornea. The initial step the nurse must do is the following. A. Remove the splinter with a sterile forceps. B. Cover the eye with eye patch. C. Irrigate one eye with sterile saline. D. Check visual acuity. Answer C. The eye should be irrigated with sterile saline to remove any debris. The splinter may be holding together important eye structures and should only be removed by a trained specialist. Visual acuity is not important at this stage, and an eye patch may further dislodge the foreign body and should not be attempted. 22. A patient has been struck in the eye with a baseball bat. What is the initial recommended treatment? A. Irrigate the eye with normal saline. B. Check a visual acuity. C. Apply warm compresses to the eye. D. Apply ice to the affected eye. Answer D. Ice should be applied to the eye as soon as possible. A visual acuity is not an initial recommendation, and normal saline will not help the eye. Warm compresses will only worsen the amount of swelling and bleeding the patient will have. Answer A. The insect should initially be killed with alcohol or mineral oil before removing it with a forceps or irrigating the ear. A hearing assessment is not necessary unless the patient reports decreased hearing after the insect is removed. Answers. 23. A patient arrives to the ED with a buzzing insect lodged in his ear. What is the first step in the management of this condition? A. Kill the insect with alcohol or mineral oil in the external ear canal. B. Pluck out the insect. C. Assess hearing in the affected ear. D. Irrigate the ear with normal saline. 24. A patient presents to the ED behind one ear. Other signs and symptoms a nurse would look out for include the following. List all possibilities. A. Earlobe swelling. B. Coolness to the skin upon touching it. C. Low-grade fever. D. Ear drainage. E. Vertigo. A, C, D. The patient likely has mastoiditis, an infection of the mastoid sinus. Symptoms can include earlobe swelling, low-grade fever, drainage from the ear, and irritability or lethargy. Vertigo is not a symptom of mastoiditis, and the skin overlying the mastoid sinus is likely to be warm. Answers. 25. A patient with a bladder infection is being discharged on Bactrim orally. What should the nurse instruct the patient to do? List all possibilities. A. Limit intake of liquids. B. Be aware of the possibility of a rash from Bactrim. C. Avoid bathing. D. Increase intake of fluids. B. D. The patient with a UTI should increase fluid intake and be on alert for a sulfur rash, which is relatively common. Bathing can be as before the UTI. 26. A patient from a motor vehicle accident is suspected to have bladder trauma because of pain radiating from the lower abdomen to what other place? A. Shoulder. B. Hip. C. Umbilicus. D. Both knees. Answer A. Pain from bladder trauma radiates to either shoulder due to irritation of the phrenic nerve. Bladder pain does not radiate normally to the hip, umbilicus, or knees. 27. A patient presents to the ED with left flank pain, fever, and dysuria. The nurse should anticipate the following. Check all that apply. A. The possibility of hypotension. B. Hematuria. C. Ectopic pregnancy. D. Renal cancer. E. Pyelonephritis. Answers. A, B, E. The patient probably has pyelonephritis associated with flank pain, dysuria, fever, hematuria, and the risk for urosepsis with hypotension. Renal cancer and ectopic pregnancy do not present with these symptoms. 28. A male patient has fallen from his horse. While putting in a urethral catheter, you notice blood at the urethral meatus. What is the next step? A. Use a small bore catheter. B. Obtain a urinalysis. C. Give pain medication prior to inserting the catheter. D. Notify the ED physician. Answer D. The trauma patient could have severe pelvic trauma and transection of the urethra. Notify the ED physician, who will ascertain the source of the bleeding before any catheter can be inserted. The other answers are incorrect. 29. An injured patient has suffered an acute renal injury. The electrolytes return with A. Answer C. The patient with hyperkalemia is at risk for cardiac arrhythmias and should be placed on a cardiac monitor before checking any of the other parameters. 30. Potassium level of 6.1 ml. What is the nurse's next clinical step? A. Obtain a urine potassium level. B. Obtain a serum sodium level. C. Place the patient on a cardiac monitor. D. Obtain a complete urinalysis. Acute bladder trauma can show the following signs and symptoms. Check all that apply. A. Anuria. B. Nausea and vomiting. C. Hematuria. D. Dysuria. E. Low abdominal pain radiating to the shoulders. Answers: A, B, C, E. A patient with bladder trauma presents with anuria, nausea and vomiting, low abdominal pain radiating to the shoulders and hematuria. They generally do not have dysuria. Answer B. A. Exception of testicular torsion. Answers: 31. A male patient presents with acute epididymitis. He is expected to have all but which of the following symptoms? 32. A. Scrotal pain. B. Testicular torsion. C. Scrotum swelling. D. Bacteria in urine. E. Fever and chills. Patient with acute epididymitis is expected to have all of the above symptoms with the. A patient presents to the ED with flank pain and shortly thereafter passes a calcium-based kidney stone. What should you tell the patient to avoid eating upon discharge? Check all that apply. A. Meat. B. Liver. C. Milk products. D. Beans. E. Fine-boned fish. C, D, E. A patient with a calcium-based kidney stone should avoid eating milk products, beans, fine-boned fish and chocolate. Liver and meat can be eaten. Answer B. Post-ed instructions to avoid recurrent cystitis include voiding every 2 to 3 hours, good perineal care, and decreasing sexual activity. They should avoid tub baths, bubble baths and sitting in a wet bathing suit for prolonged periods of time. Answer B. Signs and symptoms of hypovolemia are decreased intake and urinary output, hypoton, C-on and tachycardia. Answer, S, 33. Post-ed instructions for preventing recurrences of cystitis include: A. Void every 8 hours. B. Good. C. If pregnant, void every 6 hours. 6. D. Increase sexual activity. 34. Signs and symptoms of hypovolemia include all but the following: A. Tachycardia. B. Increased urinary output. C. Hypotension. D. Decreased fluid intake. 35. EKG signs of hyperkalemia include: list all that are true. A. Peaked P waves. B. Widened QRS. C. Peaked T waves. D. Shortened PR interval. E. Perineal care, wiping from front to back. Heart block. B, C, E. EKG signs of hyperkalemia include flat P waves, widened QRS, peaked T waves. Prolonged PR interval, heart block, ventricular fibrillation, and asystole. Answer A. TPA use should be avoided in cases of uncontrolled hypertension due to the risk of cerebral hemorrhage. The other findings do not limit the giving of tissue plasminogen activator. Answer D. The patient is clearly having an anaphylactic reaction to alteplase which needs to be discontinued with notification to the doctor. Answer C. Protamine is the antidote for heparin and should be administered along with stopping the INF. 36. A1. Patient is to receive TPA for a diagnosis of acute pulmonary embolism. What medical condition should be reported to the ED physician? A. BP of 180/110. B. Adventitious breath sounds. C. Respiratory rate of 25. D. Oral temperature of 99.5 degrees Fahrenheit. 37. A patient is receiving active ACE, alteplase. Ness of breath. What should the nurse do? A. Cut back on the infusion rate by half. B. Give Benadryl and continue the infusion. C. Give Vistaril and continue the infusion. D. Stop infusion and notify the ED physician. 38. The patient is placed on heparin drip. What should be considered if excessive bleeding? Perirectum is noted. A. Administer vitamin K and stop infusion. B. Continue infusion and give vitamin K. C. Administer protamine and stop in. D. Administer aminocaproic acid. Ision. Aminocaproic acid is an antidote for thrombolytic therapy and vitamin K is the antidote for warfarin Coumadin. He suddenly complains of itching and short. Sion. Answers. 39. A patient presents to the ED in acute pulmonary edema. What should be expected? B. C. Bumetanide is a diuretic that should decrease the amount of frothy pink sputum, increase urinary output, decrease crackles in the lungs and decrease tachycardia. 40. A patient is on a heparin drip following a stroke and the ED physician starts her on. Answer C. Warfarin can thin the blood once the INR has reached 2-3. In the meantime, the heparin drip is usually continued. Warfarin does not act in the same way as heparin and is not indicated for acute stroke. Results B. From and 4 dose of bumetanide. Check all that apply. A. Decreased urinary output. B. Decreased crackles in the lungs. C. Increased urinary output. D. Frothy pink sputum. E. Increased tachycardia. Warfarin. What can you tell the patient about warfarin? A. That the heparin will now be discontinued. B. That the warfarin is indicated for the acute treatment of stroke. C. That the patient will need to be on a heparin drip until the INR reaches 2-3 in a few days. D. That the warfarin acts the same way as the heparin. Answer C. Propranolol is a beta blocker which has, as a common side effect, bronchospasm. This. Sim. 41. A hypertensive patient presents to the ED with wheezing and bronchospasm. He was just placed on antihypertensive medication. What medication was most likely started? A. Nifedipine. B. Hydrochlorothiazide. C. Propranolol. D. Guanfacine. Tom is not seen when starting the other medications. 42. A patient on Lanoxin returns with a digoxin level of 1.2. What can you tell the patient? A. That he at risk for hypokalemia. B. That his digoxin level is normal. C. That his digoxin level is too low. D. That he is at risk for hyperkalemia. Answer B. A normal digoxin level is 0.5 to 2.0. The patient is not at risk for high or low potassium. While on Lanoxin but hypokalemia can worsen digoxin toxicity. 43. A patient is on TPA following an acute myocardial infarction. What is the most important thing to be monitoring? B. Bleeding. C. The PRO-time. The INR. D. The urine output. Answer B. While on tissue plasminogen activator, the patient should be monitored for any type of bleeding. The PRO-time, INR and urine output are not measures of TPA efficacy or toxicity. Answer A. Procainamide can cause abnormalities in the vital signs and dizziness. This is the first. TL. 44. A patient is on procainamide in order to treat a cardiac dysrhythmia. He complains of being dizzy. What is the first thing the nurse should do? A. Obtain vital signs. B. Obtain a stat EKG. C. Measure heart rate on cardiac monitor. D. Assess the monitor for prolonged QT. Thing you should assess the patient for. The other things are secondary to obtaining the vital signs. 45. A patient on a heparin drip is felt to be in therapeutic range when which of the following are noted? A. An apt of 120 or greater. B. A PT of 23. C. An apt of 28. D. An apt of 60. Answer D. The PT is a measure of Coumadin therapeutic range and an apt level of 28 indicates the heparin is not therapeutic. An apt of 120 or higher is too high. 46. The main cardiac stimulator used in a cardiac arrest is what drug? A. Epinephrine. B. Norepinephrine. C. Dopamine. D. Atropine. Answer A. In a cardiac arrest situation, the main drug used to stimulate the heart is epinephrine. The others are less often used in a cardiac arrest. Answer C. Nifedipine is a calcium channel blocker used for dysrhythmias and hypotension, but it is not a direct vasodilator. The other medications are direct vasodilators. Answer D. Verapamil, diltiazem and nifedipine are all calcium channel blockers. Hydrochlorothiazide is a thiazide diuretic and all work to correct hypertension, among other things. Answers: 47. Which of the following is not a direct vasodilator? 48. Which of the following is not a calcium channel blocker? 49. A. Nitroglycerin. B. Sodium nitroprusside. C. Nifedipine. D. Hydralazine. A. Verapamil. B. Diltiazem. C. Nifedipine. D. Hydrochlorothiazide. Beta-adrenergic blockers are contraindicated in what patient situations apply? A. Urinary retention. B. Heart failure. C. Hypertension. D. Bradycardia. E. Asthma. B. D. E. Beta-adrenergic blockers are relatively contraindicated in asthma, bradycardia, and heart failure. They are used to treat hypertension. Check all that. 50. When giving sublingual nitroglycerin for chest pain, be alert for the following. Answer A. Hypotension, dizziness, fainting, nausea and vomiting can occur when giving sublingual nitroglycerin. It should be given with a moist mouth but does not cause dry mouth. It does not cause BRAD. A. Hypotension. B. Dry mouth. C. Diarrhea. D. Bradycardia. Lacardia and can, in fact, cause reflex tachycardia due to hypotension. 51. A patient presents to the ED in acute pulmonary edema. The respirations are 28 and the BP is 140/90. What is the first medication you would likely give the patient? A. Lasix 40 mg orally. B. Lasix 40 mg 4. C. Spironolactone 10 cmg orally. D. Mannitol infusion 2 gkg 4 infused over 30-60 minutes. Answer B. The most likely choice for acute pulmonary edema is Lasix 40 mg 4. Oral dosage would take too long and mannitol is not indicated for acute pulmonary edema. 52. A patient with chest pain is hooked up to a cardiac monitor. Initially premature ventricular contractions occur that fall on the T wave of the preceding beat. There is a sudden change to a rhythm with no P waves, no QRS complexes and a coarse, irregular line follows. What does the nurse interpret this to be? A. Lead failure. B. Atrial fibrillation. C. Asystole. D. Ventricular fibrillation. Answer: the patient is having PVCs which has led to ventricular fibrillation. Asystole generally has fine or no variability in the waveform and the patient unlikely has failure of the leads because he has had PVCs which often lead to ventricular fibrillation. Answer A. Chest pain that occurs around the same time every day and usually occurs at rest is likely variant angina until proven otherwise. Stable angina comes on at rest and unstable angina would not last 2 weeks nor would it have the scenario the patient describes. Heartburn is a possibility, but it should be considered variant angina until proven otherwise. Answers: 53. A 72-year-old ED patient is complaining of chest pain. He says it has been occurring, 54, at the same time every day for the last 2 weeks and occurs at rest without any noticeable precipitating factors. It is not relieved by antacids. What does this chest pain likely represent? A. Variant angina. B. Unstable angina. C. Stable angina. D. Heartburn. A patient has just had an emergency paracentesis for cardiac tamponade. Which of the following should indicate a successful procedure? Check all that apply. A. Patient expressing relief. B. Clear heart sounds. C. Rising central venous pressure. D. Rising blood pressure. E. Falling central venous pressure. A, B, D, E. A successful cardiac paracentesis includes a fall in central venous pressure. A. Rise in blood pressure, clear heart sounds and an expressed relief on the part of the patient. 55. An EKG strip shows a pulse rate of 120 beats per minute, a PR interval of 0.14, and a QRS complex of 0.08. The rhythm is regular. What is the EKG strip showing? A. Normal sinus rhythm. B. Sinus dysrhythmia. C. Prolonged QT interval. D. Sinus tachycardia. Answer D. The patient has a regular but fast rhythm of 120 beats per minute, indicating sinus tachycardia. The PR interval and the QRS complex are within the normal range. 56. A patient has just had cardioversion. Which nursing action takes the highest priority? A. The patient's level of consciousness. B. The status of the patient's airway. C. The EKG. D. The blood pressure. Answer B. Following a cardioversion, the adequacy of the airway should be assessed first, followed by the blood pressure, the patient's level of consciousness and the follow-up EKG. 57. The most successful cardioversion would lead to the following outcome. A. Non-arousable, BP 90/50. Pulse 90. B. Arousable, BP 100/60. Pulse 40. C. Arousable, BP 114/70. Pulse 72. D. Non-arousable, BP 130/80. Pulse 60. Answer C. The patient who is arousable following cardioversion with normal vital signs indicates the most successful cardioversion. Patients who are unable to be aroused or who have abnormal vital signs have had a less successful outcome. 58. A patient arrives to the ED and goes into ventricular fibrillation. The monophasic defibrillator should be set at what level in joules for the first defibrillation? A. 50 joules, B. 200 joules, C. 300 joules, D. 360 joules. Answer D. A monophasic defibrillator for ventricular defibrillation is always set at 360 joules. 59. A nurse is set to defibrillate a patient who is in ventricular fibrillation. Just prior to discharging the defibrillator, which of the following should be done? A. Set the defibrillator to synchronize mode. B. Verify that the patient is in ventricular fibrillation. C. Obtain vital signs. D. Intubate the patient. Answer B. The patient in ventricular fibrillation will not discharge the defibrillator in synchronize mode. Verify the rhythm prior to discharging the defibrillator. Intubation and the taking of vital signs only wastes valuable time for the patient in ventricular fibrillation. 60. The patient is in atrial fibrillation with a heart rate of 150 beats per minute. What will the nurse watch out for? A. Hypertension and headache. B. Hypotension and dizziness. C. Sudden onset of bradycardia. D. Nausea and vomiting. Answers B. With a ventricular rate of 150 beats per minute, there is the possibility of resultant hypotension and physical symptoms of dizziness. 61. The patient is having recurrent episodes of ventricular tachycardia. Which should be of primary concern? A. Causative factors, including caffeine intake. B. The rhythm could deteriorate into AFib at any time. C. The patient will feel very uncomfortable during these episodes. D. The patient's vital signs. Answer B. The finding of recurrent VTach is worrisome as it can deteriorate into ventricular fibrillation at any time. It is less important to understand the causative factors, the patient's level of discomfort and the patient's vital signs. 62. The patient is on a cardiac monitor and the alarm goes off. The tracing is flat. What is the first thing the nurse should do? A. Call a code blue. B. Turn off the machine and turn it back on again. C. Prepare the defibrillator. D. Check the patient's status and leads. Answer C. As the tracing could be flat because the leads are off. It is a quick thing to check the leads and the status of the patient before jumping to conclusions that the patient needs a code blue or a defibrillator. Turning the machine off and turning it back on again is not a priority. Answers: 63.